Dr. Kevin OBENG-MARNU, MD. Welcome, ladies and gentlemen. I'm Dr. Kevin OBENG-MARNU, a practicing neurosurgeon. Most honored that you are joining me once again for the United States Medical Licensing Examination. Thank you. The summer edition of the year of our Lord, June 2023. Dr. Kevin Marnu's USMLE official master series. Keywords, clues, strategies, smart study tips on how to solve the questions within seconds in order to ace the boards. Now, let's just get straight to the point. Today's question is going to be USMLE Step 1 Pathology. But before I proceed, let me remind you that one, always remember that before you begin solving the question, look at the last sentence and try as much as possible to abstain from looking at the answer options, okay? Do not look at the answer options. Read the last sentence and then you can get to the top of it, okay? When you get to the top of it, look at the age, look at the gender, look at the ethnicity if there is one, like an African American, a Caucasian, is it an Asian, is it an Arab, is it a Southern American, okay? Is it a pure African? All right, an immigrant from India, from Bangladesh, etc. So you have to put that into consideration if the ethnicity is given, because these are all keywords and clues in answering the question. Okay, then you can look at a chief complaint. The chief complaint is always important. Why is the patient coming to you as a physician for help? This is what you must be thinking about. Why is this patient coming to me for help? Okay, so that is a chief complaint. And then you can look at the vitals, like the temperature or any other vitals which has been given, like the respiratory rate and, etc. All right, and the lab test, the diagnostics, etc. Okay. All right, without further ado, bingo. Here goes the question right on your screen, ladies and gentlemen. Now, wait. Y'all can pause it. You are home. Y'all can pause it. And then you can read through it quickly and choose your answer before we proceed, okay? I want you to choose your own answer before we proceed. So I'm going to read through the questions first and then we can solve it, all right? Okay, so let's go. An 8-year-old boy is presented to the hospital due to facial tenderness and nasal congestion. The patient's first episode of congestion was approximately a year ago. His parents sought to over-the-counter allergy medication as means of treatment, but to no avail. His congestion has worsened over the past 6 months and subsequently developed breathing difficulties through his nostrils, with associated dry cough and persistent dull pain over his cheeks. The patient experiences loose stools. Temperature is 37.9 degrees Celsius, which is the same as 100.22 degrees Fahrenheit. Weight is at less than the first percentile at 17.5 kg, which is 38.5 pounds. Apparently decreased from 19 kg, that is 41.8 pounds, 4 months ago. Physical examination reveals lack of lymphadenopathy, but there is copious yellow mucus in both nares and translucent gray shiny masses obscure the middle turbinates bilaterally. His abdomen is soft without organomegaly, but lungs have coarse breath sounds bilaterally. Okay? And now this is the big deal. Which of the following is the most likely diagnosis? Like I said, before you start, do not look at the answer options. Always read the last sentence first. And over here, the last sentence is which of the following is the most likely diagnosis. So you have to come into a realization that all they want from you is a diagnosis. Okay? Now, the USMLE wants you to diagnose this patient. So at the back of your mind, you know that you are looking for a diagnosis, okay? So after you know what you're looking for, then you can proceed to the top of it. The first thing you got to do is read which of the following is the most likely diagnosis. After that, you can go to the top and start reading, about the age, the gender, etc. Okay? All right. The diagnosis being given, option A is primary ciliary dyskinesia. B, HIV infection. C, Young's syndrome. D, cystic fibrosis. E, seasonal allergic rhinitis. And F, nasopharyngeal carcinoma. I personally added the Young syndrome for a reason, all right? All these questions are strategized by me. It's my personal strategy. So I'm going to teach you the reason why I added some of these answer options to the question and why I twisted the question in this manner. Well, the first thing you got to realize is that this is a 7-year-old boy, okay? It's a young patient with what? Chronic rhinosinusitis, all right? Nasal congestions which are persistent for over a year. That is a sinopulmonary disease. And then another thing you got to realize is that the patient has loose stools, all right? Loose stools, that's a form of diarrhea, and also nasal congestions, sinopulmonary or chronic rhinosinusitis, and also they have facial pain, all right? The facial tenderness, all right, with a chronic cough. And take notice that the patient's family or the patient's parent thought it's a form of allergy, all right? Just like a seasonal allergy. So they tried over-the-counter medication or allergy medications, but never worked. So that means choice E is out. Seasonal allergies is out. All right, so that is a distraction right there. Choice E is a distraction. So you can mark that out. All right, so this is cystic fibrosis, ladies and gentlemen, okay? This is cystic fibrosis. If you know the differences between cystic fibrosis and kartagener syndrome, all right? Super high yield, extremely important for the USMLE. Cystic fibrosis, kartagener syndrome, all right? This is very, very important, and they move hand in hand. I purposely added choice C, which is Young's disease. So Young's disease is similar to cystic fibrosis, very, very similar. The differences between Young disease and cystic fibrosis is that it doesn't happen in kids, okay? It happens somewhere in adulthood, between the ages of 30s to 50s. Etiology is unknown, but it's believed that young kids who are exposed to mercury develops Young disease at some point in their lives, okay? This patient lacks what? Lymphadenopathy, which is very clear. That means it's not any form of infection like HIV or, you know, whatsoever. But there is copious yellow mucus in both nares and also no organomegaly, etc. But the lungs have caused breath sounds bilaterally. So that is bronchiectasis. Okay, so bronchiectasis is common in Young's disease. It is also common in kartagener syndrome, okay, and also common in cystic fibrosis, okay? So we have to now differentiate. So take notice, we have differentials of kartagener syndrome. We have kartagener syndrome is the same as primary ciliary dyskinesia, which is choice A, same as kartagener syndrome, okay? And then we have cystic fibrosis and we have Young's disease. But like I said, in Young's disease, it happens in adulthood, okay? You don't have that in kids. This is an 8-year-old boy. So obviously that can happen, okay? Okay, take notice that kids in the United States are always screened, newborn babies are always screened for cystic fibrosis, but sometimes it goes undetected. So that is why this 8-year-old boy still suffered from cystic fibrosis, okay? But normally across the United States is being screened. Remember, this is an inherited disorder, okay? So your genetics comes in, all right? So that is autosomal recessive. Same with kartagener syndrome. Kartagener syndrome also autosomal recessive. Remember, the cftr gene mutation, that is a delta 508. All right, so this is something they can also ask you in your medical genetics questions. Okay, so take notice of that. And then, of course, cystic fibrosis patients suffer from pancreatic insufficiency. So as a result, you need to supplement the pancreatic enzyme. So this is the main reason why they have steatorrhea and also loose stools, diarrhea, you know, etc. So take notice of that, all right, with cystic fibrosis. Okay, which is not common in kartagener syndrome. Okay, so kartagener syndrome, they don't really have the pancreatic insufficiency like cystic fibrosis, all right? One thing you got to realize is the infertility problem, okay? Cystic fibrosis patients have difficulty in giving birth or having babies, okay? Same with kartagener syndrome. Classic board question is the infertility. So whenever you read the question, they're talking about infertility. For instance, this 8-year-old boy is now a 32-year-old man, okay, and wants to have babies and he doesn't have a baby, all right? So they have infertility problems. So this is as a result of what? Absent vas deferens. The spermatic canal is lost, it's absent. Take notice, it's different from kartagener syndrome. With kartagener syndrome, they have the vas deferens intact, okay? The epididymis, the ejaculatory duct and everything is intact. The only problem they have is the microtubule. So the kartagener syndrome is what? It's a dining arm defect, okay? Mucociliary defect in the ciliary body. So that is why it's a primary ciliary dyskinesia. As a result, patients suffer from infertility because the sperms cannot propagate or cannot swim towards the ovary because the ciliary body has a defect. So take notice of that, as compared with the cystic fibrosis being absent in the vas deferens, okay? And also in female patient, if it's a female, yes, they can also suffer from ectopic pregnancies because the ciliary bodies in the fallopian tubes are defective. So as a result, the fertilized ovum can implant anywhere within the fallopian tube. Okay, so take notice of that is kartagener syndrome. Also, kartagener syndrome, they suffer from what we call the situs inversus. So you can see some images right on your screen. That is situs inversus, which is the same as dextrocardia. Okay, so sometimes it can show you an image of the dextrocardia, and that is a total giveaway. That is kartagener syndrome as compared with cystic fibrosis. Okay, so dextrocardia doesn't really happen in cystic fibrosis. Okay, and pancreatic insufficiency doesn't happen also in kartagener syndrome. Okay, Young's disease have all that cystic fibrosis has. Okay, it has all that the bronchiectasia, etc. But the problem is that in Young's disease, it's supposed to happen in late adulthood, and that is not an inherited disorder. Okay, kartagener syndrome and cystic fibrosis are inherited autosomal recessive disorder. Okay, so as compared with that, so take notice of this. All right, so this is very super high yield, extremely important for you to know. All right, we've talked about choice A, primary ciliary dyskinesia. Let's look at choice B, being the HIV infection. HIV infection in a young kid, the only way a young child can have HIV is vertical transmission or blood transfusions. Although kids with HIV will have weight loss, chronic rhinosinusitis, but remember, the only way a young child or a young boy can develop HIV/AIDS is perinatally. Okay, so vertical transmissions and all that. So the symptoms are gonna come out real fast by the age of 2. Okay, the baby is going to have problems. This is an 8-year-old boy, so that is quite too late, all right? So take notice of that. Young's disease, of course, I've explained to you, is similar to cystic fibrosis. Choice E being the seasonal allergic rhinitis. We marked that out in the beginning. Nasopharyngeal carcinoma is a tumor, all right? And normally it's unilateral. It's not bilateral like in this patient. And of course, it doesn't happen in a kid. Okay, it doesn't happen in a young boy. So remember the kissing bug, Epstein-Barr virus, the nasopharyngeal cancer, or the nasopharyngeal carcinoma. So that happens in an older patient. Well, I've seen patients who are 26 with nasopharyngeal carcinoma, okay, develop as a result of an Epstein-Barr virus. I have a couple of patients who are 26 years old with that, but normally it happens in a 40-year-old or a 50-year-old man. So for a young kid of 8 years old, that is not really possible in this case. All right, so that is the end of today's session. Thank you for joining me always. All right, I hope that was pretty easy, right? So remember, cystic fibrosis, kartagener syndrome, okay? They have similar symptoms, okay? They are all inherited disease, autosomal recessive. They suffer from infertility problems, bronchiectasis, sinopulmonary diseases. That is a chronic rhinosinusitis. But there are differences which I have already elaborated. So take notice of it. It's a classic board question. And no matter what, 100%, I promise you're gonna meet that on the day of your exam. Cystic fibrosis versus kartagener syndrome. Take a good look at that. Thank you for joining me. I gotta go now. Until then, zaijian. Arigato. Bye-bye. Wow. Hello, family. This is Dr. Kevin OBENG-MARNU, MD. Y'all welcome to my channel. Subscribe, like, comment, and share. And God bless. Thank you.